My work over the last 3 years has centered around COVID-19 vaccine engagement, specifically within the African, Caribbean, and Black communities. I have focused on the African, Caribbean, and Black communities following the news that the communities weren't taking up the vaccines. And I was very curious to understand why that was the case. So I did 3 series of research, and the first one was around understanding whether people would take the vaccines or not. In the second one, I was keen on understanding hesitancy across the different doses. The third, I used a different methodology entirely. I used videography to try to get people to speak to the camera so that we can have a situation where stakeholders, including Public Health Scotland, the Scottish Government, communities, health practitioners, were speaking to each other and they were hearing firsthand from one another. When I done the documentary, it was premiered on the 7th of October 2022. We had different stakeholders, the community members, Public Health Scotland, Scottish Government officials, but I wanted to reach more into the African, Caribbean, and Black communities. Because it's available online doesn't mean people will engage with it. So that was how the GKEF, the Glasgow Knowledge Exchange Fund, came about to help us to reach more deeply into the African, Caribbean, and Black communities.
My initial contact was around the 6 community engagement events that Josephine was running, so the local events that were happening across Scotland. And part of my role was to make sure that there was local attendance from the NHS. So the original film screening, Public Health Scotland were part of that, and we were part of that discussion. But I would say that that conversation was at a national level, and this was a great opportunity locally for conversation to happen between local NHS with local community members.
So when I was applying for the GKEF fund, I wanted all the partners that worked with me on the documentary to also be part of this. Because, this is not just about research, but we're trying to get impact as well. So I approached Public Health Scotland, I approached the Scottish Government, and I approached my community partners who are going to help to host us. And they all agreed to be part of this project. So Public Health Scotland was very instrumental to the success of the project.
Since meeting Josephine and since the work that we've done with the 6 community events, we have developed a new resource targeting new entrants to Scotland, and it's around all vaccinations. Josephine's research and the partnership working that we did with the local community events, hearing voices and hearing that conversation, it was brilliant.